Have you ever felt invisible? Like your health, your very life, simply didn't matter enough? Imagine a world where a single illness could erase your savings, your home, your future. This isn't a distant nightmare. It's the reality for millions in the wealthiest nation on Earth. A nation brimming with medical innovation, yet tragically failing to provide basic care for so many. We live in a country where access to healthcare often hinges not on need, but on a zip code, a job, or simply the size of your bank account. It's a quiet crisis, a slow burn of desperation that leaves families shattered and lives needlessly lost. What does it say about us, as a society, when a medical emergency can bankrupt a family? When someone is forced to choose between food on the table and seeing a doctor? I'm William Brangham, and we began a journey to understand why this is America's reality. A journey that took us across continents, seeking answers in places where healthcare isn't a privilege, but a fundamental right. We asked a simple question: how do other nations care for nearly everyone, often at a lower cost? What can we learn from their successes and their struggles? Our story starts in Houston, Texas, the epicenter of medical breakthroughs, a place where doctors are pushing the boundaries of what's possible. Here at the Texas Medical Center, they're building artificial organs, designing surgical robots, and using virtual reality to navigate the most complex procedures. It's a testament to American ingenuity. Meet Casson Cox. 5 years old, full of energy, a vibrant child who embodies the power of modern medicine. Casson was born with half a functioning heart, a condition that for many means a tragically short life. But thanks to the skill and innovation of doctors like Dr. Jorge Salazar, Casson is thriving. Casson was going to die, Dr. Salazar explains, his voice filled with a quiet pride. Had we done what we've always done, he would have had a transplant already, or it's hard to say, but he would have passed away already. Now, Casson is a normal child, running, playing, simply living. His story is a beacon of hope, a symbol of what's possible when medical science reaches its full potential. The Texas Medical Center performs over 180,000 surgeries a year, attracting patients from around the globe. It's a world-class institution, a source of national pride. But just a few miles away, a starkly different reality exists. A world of limited access, systemic disparities, and heartbreaking choices. In North Houston, the landscape shifts. The gleaming towers of the medical center give way to struggling communities, where residents face a daily battle against poverty and a healthcare system that often feels stacked against them. Elena Marks, president of the Episcopal Health Foundation, took us on a tour, revealing a painful truth. You have the very best and the very worst within just a few miles, she says, her voice laced with frustration. And it's just not fair. And it doesn't have to be that way. The residents here, predominantly Black and Hispanic, are disproportionately uninsured. They often delay care until it's too late, facing a life expectancy 20 years shorter than those in more affluent areas of Houston. It's a heartbreaking statistic, a testament to the enduring inequalities that permeate our healthcare system. If you could get to the medical center, that would be great, Marks observes, but you'd probably be really sick by the time you get there because of the neighborhood you live in. We met Ruby Glass, a resident of North Houston, who shared her fears as the pandemic loomed. Can you imagine if that hit my community? A lot of us don't have insurance. Where do we go? Her question hung in the air, a chilling reminder of the vulnerability faced by so many. Across the table, a chorus of voices echoed her concerns. From the ports of the poor to the riches of the rich, we don't get the same quality of care. It's kind of the implicit bias of the medical field towards people who have black skin. It's all greed. The pharmaceuticals, insurance companies, it's greed. The pain, one woman shared, wasn't just physical. It was the pain of knowing that nobody truly cared. America spends over $3.8 trillion on healthcare annually, nearly a fifth of our entire economy. More than all other high-income nations combined. Yet our health outcomes lag behind. We're often called the most expensive, least effective healthcare system in the world. More than 30 million Americans are uninsured, and millions more are one medical bill away from financial ruin. We spoke with LaQuisha Parker, a certified nursing assistant who dedicated her life to caring for others, only to find herself unable to afford care for herself. She worked tirelessly, assisting patients after surgeries and illnesses, providing intimate, compassionate care. But her job didn't come with health insurance. "I'm actually working in healthcare and can't afford to pay for it," she says, her voice filled with disbelief. That's not right. For years, Parker went without checkups, delaying care until a terrifying discovery, a tangerine-sized lump in her breast. Malignant cancer. She found a clinic that offered a sliding scale based on income, but only after her diagnosis did she qualify for Medicaid. The surgery was successful, but left her with limited use of her arm, costing her her job, her apartment, and ultimately her home. "If I would have had insurance at that time, health care that I would have been able to afford, I would have easily accepted it," she says. But then comes the question of having somewhere to live, having something to eat, gas to get back and forth to work. The choices were impossible, the burden unbearable. Houston represents a microcosm of America's healthcare crisis. Brilliant innovation alongside devastating inequality. Dr. Rishish J.H.A., Dean of Brown University School of Public Health, sees a fundamental flaw in our approach. "I reject that dichotomy," he says. "Somehow, we have to have 25% of people uninsured if we're going to have a highly innovative healthcare system." There are many reasons to reject that. Innovation comes at a cost, he acknowledges, but we can afford to invest in both progress and universal coverage. The challenge is finding the political will to do so. How do we preserve the life-saving care that benefits someone like Casson Cox, while ensuring that millions like LaQuisha Parker aren't left behind? To seek answers, we turn to other nations, countries that have successfully navigated the complex landscape of healthcare and achieved universal coverage. Our first stop, the United Kingdom and its National Health Service, known as the NHS. We met Liam Murphy, a 10-year-old boy with Down syndrome, epilepsy, and chronic lung disease. His life is a constant battle, requiring frequent hospitalizations and round-the-clock care. The NHS provides it all, free at the point of service. "No one says that's going to cost too much, so we're not going to do it," Liam's mother, Angelina, says with gratitude. You've never heard those words. The NHS, funded by taxes, ensures everyone has access to care, regardless of their income or social status. But the NHS isn't without its challenges. Long waiting lists, staffing shortages, and funding constraints are constant concerns. Olive Parfit, a 77-year-old woman, waited nearly a year for a knee replacement. "If I have a heart attack tomorrow, they'll take me in," she says with resignation. But when you've got disabilities that are not life-threatening, they can't cope. The NHS relies on a unique body, the National Institute for Health and Care Excellence, or NICE, to make difficult decisions about which treatments are cost-effective. It's a controversial process, often described as rationing care. But as health policy expert Thomas Seltner explains, rationing already exists in the U.S. It's just based on ability to pay. Despite its imperfections, the NHS remains a cherished institution, a symbol of British values. Even during the pandemic, when the system was stretched to its breaking point, its commitment to universal care never wavered. Our journey continued to Switzerland, a nation known for its precision, its quality, and its unique approach to health insurance. Here, residents choose from a wide array of private plans, but everyone is required to have coverage. The system is highly regulated and subsidized, ensuring affordability and access for all. Here, it's a bit more humane, says Jason Preston, an American teacher who moved to Switzerland. Look, there's a basic level of care that people deserve. It costs, but you still deserve it. Switzerland's system isn't without its critics. Premiums can be high, and some families struggle to afford coverage. But it provides a safety net that prevents medical bankruptcy and ensures everyone has access to care. Finally, we traveled to Australia, a country with a hybrid system, a public system called Medicare, supplemented by private insurance. Here, the two systems coexist, offering a balance of choice and universal coverage. Paul Dunn and his wife, Filafania Lacera, represent the divide. Paul and Filafani rely on Medicare for their care, while Paul's parents prefer the perks and quicker access of private insurance. The system is designed to relieve pressure on the public system, but it's also facing challenges as more Australians opt out of private insurance. Australia's response to the pandemic was swift and effective, thanks in part to its universal healthcare system and its ability to coordinate a national response. But gaps in long-term care and inequities in access to care remain. So what have we learned? There's no one-size-fits-all solution to the healthcare crisis. Each nation faces its own unique challenges and trade-offs. But the common thread is a commitment to ensuring that everyone has access to care, regardless of their ability to pay. As we navigated this complex landscape, we kept returning to one central question: is healthcare a right or a privilege? And as we saw the life of LaQuisha Parker transform, we were reminded that the answer to that question has profound consequences. "I was homeless, unemployed, and living in a shelter," she said, her voice filled with emotion. "But now I have keys to my apartment. I was helped to get keys to a car. So things have been on the upswing. I'm grateful." Her story is a testament to the power of hope and the resilience of the human spirit. But it's also a call to action. A reminder that we can and must do better. We can choose to build a healthcare system that prioritizes people over profits, that values health over wealth, and that ensures everyone has the opportunity to live a healthy, fulfilling life. The sun literally comes out as you say this. Yes, it won't be like this all the time.